Good evening, everybody, and welcome to Broadcasting Buffalo. This is a collaboration between SUNY Buffalo State students and the Buffalo Broadcasters Association. It's highlighting important issues in our community. I'm Mike Igoe, and in this particular episode, we are discussing the COVID-19 vaccine. You know, more than 500,000 Americans have died from COVID, and health experts are hopeful. They're hopeful that newly developed vaccines for the virus will bring this pandemic finally to an end. Still, many are left with questions about the safety of vaccines that were developed so quickly. Our student reporter, Evan DePasquale, shares with health experts some ideas about they feel are not usually against vaccines, but are hesitant to take a COVID-19 vaccine in this case.
In mid-December, the first doses of the COVID vaccine came available in the United States in hopes of ending the pandemic. As you can see, there are many people lining up trying to get the vaccine as well, but still, many people are skeptical about getting the shot.
I really just don't trust the whole process.
Rob Gurman is a probation officer with Erie County and was offered a chance to get the vaccine, but he's not quite ready.
What concerns me the most is the rushed development of it and the fact that it's, in my opinion, hasn't been adequately tested.
More than anything, just because we don't know the long-term effects. So things like fertility, any side effects it could have.
Gurman is not the only one who believes the vaccine was rushed. We also spoke to a teacher who is eligible to take the vaccine, but does not feel comfortable taking it.
I don't really know how it corresponds with like breastfeeding or, with somebody who's pregnant.
She was not comfortable being on camera, but told us she is worried that the vaccine could affect her plans for a family.
Hopefully future mom within the next few years. To me, it just kind of seems like a risk that I'm not exactly sure that I want to take just yet.
Gurman knows a number of people who contracted the virus. He said in their experience, it was not much worse than a common cold.
The mortality rate for my demographic is very low. So I don't see much of a health advantage to taking a vaccine.
Kathy Kreisman had a very different experience when she became sick with COVID in November.
It was the worst illness I've ever had in my life.
Kreisman was sick for 3 weeks with COVID symptoms and was sick with pneumonia for another week after that. She strongly encourages everyone to get the vaccine.
I would want them to know that my personal thoughts were you could put any vaccine into my body as long as I never get as sick as I was in November.
Dr. Thomas Russo is an infectious disease expert at UB Medical School. He is hopeful that enough people will want to get the vaccine and put an end to the pandemic.
And I think all of us could agree, right? We want to get back to some semblance of normalcy, right? The best way to do that is to achieve herd immunity by getting 75 to 80% plus of individuals here in Western New York vaccinated.
For more information about the COVID vaccine, and if you are eligible to get it, you can go to our website at broadcastingbuffalo.com. For Broadcasting Buffalo, I'm Evan DePasquale.
Tonight, we have two guests joining me in the studio who have very strong feelings on both sides of this important issue. Dr. Beth Kozlowski is emergency medicine resident physician at the UB Jacobs School of Medicine. She believes the vaccines are a scientific breakthrough which will protect people from becoming seriously ill. And also, Gina Gentry is a mom who's opted not to take the COVID-19 vaccine. She was disappointed when New York State removed religious exemptions from vaccines back in 2019. She's here to tell us more about why she believes people should pause before signing up to get any of those COVID-19 vaccines. When we return, we'll talk to both of our guests. Stay with us, everybody.
Believe, inspire, achieve. These three simple words capture the progression of each student's journey at the college.
Believe. Education works best when powered by confidence and a positive attitude. When students believe in themselves, great things can happen.
Inspire. Active learning among a peer group of engaged and community-minded leaders inspires great thinking and doing.
Achieve. On a very practical level, each student finds the support and resources at Buffalo State to achieve their goals. Achievements continue on through our more than 100,000 alumni throughout the world.
Hello, Buffalo. I'm Ed Asner. You may remember me as television's no-nonsense news director Lou Grant. And if you think about it, journalists provide us with our first draft of history. Right here in Buffalo, more than 50 years of TV news coverage is being brought back to life. Local stations are working with the Buffalo Broadcasters Association to bring back the stories that help define the Niagara frontier.
The Pheasant Lane neighborhood, where drifts reach to the rooftops.
It's called the Archive Project, and I support it with all my heart. So should you.
No matter the occasion, Premier Gourmet is here for you. Featuring Buffalo's best craft beer selection, grocery store items, coffee, and gifts. Find locally made Buffalo products and everything you need for your home bar. Visit premiergourmet.com.
Experience Buffalo and Erie County's unique stories with the new Buffalo History Museum podcast. Connect with Western New York's history as you listen to detailed narratives about heritage, architecture, business, innovation, and significant events and people throughout time. The podcast takes inspiration from the museum's collection and beyond, from experts on staff and featured guests. From the 1918 influenza to F. Scott Fitzgerald, experience the stories that make up our region. The Buffalo History Museum podcast. Listen wherever you get your podcasts.
No matter the occasion, the Premier Group is here for you. Take advantage of our easy online ordering and curbside pickup. Or shop the finest selection of unique wines, spirits, and gifts at any of our 3 independently owned Western New York locations.
Your life has taught you a lot. Now your experience can help change a child's life. Read to Succeed and AARP Experience Corps are looking for local volunteers, 50 and older, to help children in Buffalo City schools learn to read. You'll receive training to help you be a great tutor. You have what it takes to change a young person's life. The experience may even change your own. Volunteer by going to readtosucceedbuffalo.org.
Welcome back to Broadcasting Buffalo. I'm Mike Igoe. Joining me now to talk about the COVID-19 vaccine is Dr. Beth Kozlowski and Gina Gentry, who have pretty much opposite sides of the spectrum. So Gina, let's start with you. You are opposed to it. You're a mother of 4. And nowadays, when so many people are dying to get the vaccine, really want to get it, people may find it a little surprising that you don't want it. Why is that?
Well, I believe that this vaccine has been definitely fast-tracked more than others. And my concerns are the fact that I've printed off pages from the CDC, the VAERS reporting, that over 11 pages of people that have passed away since the vaccine first started. There's also the Public Readiness and Emergency Preparedness Act that was put into place by the federal government, where these vaccine manufacturers are not held liable for any deaths, so you can't sue anybody with this emergency use vaccine. It's not like the other vaccines, it's right now for emergency use, so there is no liability, there's no data supporting what's going to happen in the long term. And I think that that is a concern for somebody who is skeptical at first of vaccines, but in the respects that this is one that has not been thoroughly studied. There are ingredients in them that are questionable. I know in the Johnson there is the polysorbate 80, which has been linked to cancers in humans. So for me, the risk is, do I get a vaccine that I don't know the long-term effects with ingredients that are going to eventually possibly cause more harm, or do I trust that I can take care of myself when a virus enters my body?
Yeah, but what about that CDC report? I looked it over myself, and apparently it's been less than 1% of the people who died And according to the CDC report, there's no direct correlation to that. It's people who had other pre-existing conditions. So you definitely cannot necessarily connect the dots to it being the vaccine that killed them.
So this is the actual VAERS reporting system, which is the Vaccine Adverse Events reporting system that has linked all of these deaths to the vaccine. It actually has the script of what happened to the patient, whether they expired right away, whether they had any side effects, and then they expired. So it's a little bit different than the CDC reporting of the specific, adverse reactions. There's also been over 40,000, well, in the first month, there were over 40,000 cases of serious side effects that were reported. Most of those were, there was anaphylactic shock, which is concerning to some people. There are people that have, other events that could happen that have made them unable to work.
Now, are your concerns strictly safety, or do you have any religious concerns at all?
I also have religious concerns. I have, I'm very much about what is put into my body, being created by God. And again, some of the vaccines have, especially the Johnson & Johnson, which has been renounced by the Catholic Church for using aborted fetal cell lines.
But yet, there's been times in other vaccines in the past when the government has forced families to take it for the safety of the community. How do you feel about that?
I don't feel that this is a government issue. I feel that it is something that needs to be between a healthcare provider and a patient, because they are the ones that know their patients, whether they know their medical history or if they also know their religious beliefs.
Okay, Dr. Kozlowski, I believe you are the other side of the spectrum here. What are your thoughts about the vaccine?
I support the vaccine as being committed to a career in science. I choose to trust in science. I do understand your concerns, how quickly it came out. It was studied in humans, though. It was found to be safe. We don't know the long-term efficacy of it. That is one thing, but at least in the immediate short term, it is proven, between 95% for the one vaccine, 94% for the other after the 2 shots to be effective in preventing the vaccine. And as someone who's seen firsthand patients with COVID, the effects it can have, these people are very, very sick, and the effects are very devastating. And as anything in medicine, we choose, benefit versus risk. If the benefit is higher than the risk, then it's worth doing. And I feel in this instance, benefit outweighs the risk for the general public for sure.
Now, typically, as I mentioned, most people really want to get the vaccine. They're literally fighting and going online all the time and whatnot. Have you run into other people who do not want it or are afraid of it?
There are a mix of people, yeah, for sure. There are some even other people in the medical field that are choosing to hold off on it. Not so much fear of vaccine in general, but again, because of concerns of how quickly it came out. In the general public, most of my family and friends that I've talked to, everybody is very eager to get it. I haven't come across anyone who's hesitant for it.
Now, Gina had some concern about some of the ingredients that were in the vaccine. Do you have any of those concerns as a physician, some of the other things? I know there was a rumor that mercury was in it. Apparently, I've checked on it. There is no mercury in it.
I didn't see that on the CDC website. No, looking at the ingredients. I am not concerned. I don't think anything different was done opposed to, other vaccines. Preservatives are necessary in there. So I don't have any concerns about that. I've received both shots already. I had the first one in late December, and then the second one in late January. And I had the typical, immunological response to it, but other than that, I didn't have any adverse effects from it.
Do you think it's working overall in the big picture?
I think so. I think it's really a big step in trying to get life back to normal, and not even just life back to normal, but a lot of families were really affected by this, and I think it's hard for the general public to necessarily see it unless they're affected with someone in their family, in their friend group. But they just hear about, a lot of people, that had it and recovered from it and were fine, and they're not seeing what we see firsthand of the people who get really, really sick from this.
Okay, we're going to pause right there for a few minutes. So we come back on Buffalo Broadcasting. We're going to have more of our conversation about the COVID-19 vaccine. Please stay with us, everybody.
This is a college that inspires. Here you'll be engaged, strive for excellence, and prepare for a career. Visit our amazing Elmwood Village campus and apply today. You'll achieve your edge here. This place is Buffalo State College.
Hello, Buffalo. I'm Ed Asner. You may remember me as television's no-nonsense news director Lou Grant. And if you think about it, journalists provide us with our first draft of history. Right here in Buffalo, more than 50 years of TV news coverage is being brought back to life. Local stations are working with the Buffalo Broadcasters Association to bring back the stories that help define the Niagara frontier.
The Pheasant Lane neighborhood, where drifts reach to the rooftops.
It's called the Archive Project, and I support it with all my heart. So should you.
No matter the occasion, Premier Gourmet is here for you. Featuring Buffalo's best craft beer selection, grocery store items, coffee, and gifts. Find locally made Buffalo products and everything you need for your home bar. Visit premiergourmet.com.
Experience Buffalo and Erie County's unique stories with the new Buffalo History Museum podcast. Connect with Western New York's history as you listen to detailed narratives about heritage, architecture, business, innovation, and significant events and people throughout time. The podcast takes inspiration from the museum's collection and beyond, from experts on staff and featured guests. From the 1918 influenza to F. Scott Fitzgerald, experience the stories that make up our region. The Buffalo History Museum podcast. Listen wherever you get your podcasts.
No matter the occasion, the Premier Group is here for you. Take advantage of our easy online ordering and curbside pickup. Or shop the finest selection of unique wines, spirits, and gifts at any of our 3 independently owned Western New York locations.
Your life has taught you a lot. Now your experience can help change a child's life. Read to Succeed and AARP Experience Corps are looking for local volunteers, 50 and older, to help children in Buffalo City schools learn to read. You'll receive training to help you be a great tutor. You have what it takes to change a young person's life. The experience may even change your own. Volunteer by going to readtosucceedbuffalo.org.
Welcome back to Broadcasting Buffalo, everybody. We're continuing our conversation about the COVID-19 vaccine. We have with me tonight Dr. Beth Kozlowski, who's on the front lines in the battle against COVID-19, and Gina Gentry, a mom of 4, who's pretty much opposed to it. So, Gina, I guess the obvious question is, if you are forced to do this, and we've seen this in the past, that governments have forced moms or whoever to get a vaccine for the safety of the public, how are you going to respond to that?
I would definitely fight against it and everything. There's other medical exemptions and religious exemptions for adults. I believe if necessary, though, I would have to move out of state to one that believes in freedom of choice and doesn't force their constituents or their citizens to get the vaccine.
So you feel very strongly that you would be willing to leave New York State as a matter of
absolutely.
principle, huh?
Yes, absolutely.
Well, since you pointed us in that direction, what's the difference in the other states? The other states are not as strict as New York State, or what's generally been the law of the land?
They believe in personal freedom, and they believe that it's pretty much my body, my choice as far as it goes with the vaccine, that if you want to get it, that it is your choice to get it. So states like Florida, South Dakota are 2 of the states that honor people's choice for this and leave it up to, like I said, the healthcare provider and the patient if this is something that is important for them or necessary for them to get. It's not forced.
Now, you told me there's a couple components of this vaccine that you didn't like. You mentioned the ingredients that were in it, and also you mentioned the fact that you felt there were deaths connected with it. Is there anything you see on the horizon that could make you more comfortable with the COVID-19 vaccine?
I believe after long safety studies, but personally because of religious beliefs, it is something that I would not even touch. And I, you know, listening to people's stories that I know that have gotten the vaccine. I mean, there's some people that have the typical immunological response. I do know someone that has connections with 3 people that have died from the vaccine. So there's both sides of the story, and I think that, again, forcing it is not the correct way. I think there needs to be informed consent, and I think that people need to be fully educated. When I've gone to the doctor and topics like this have come up, they don't sit down and explain to me everything that I need to know about it. In fact, I was injured by a vaccine, and I wasn't given any information beforehand, giving me any whereabouts that this could possibly happen to me.
Well, I'm curious, how do your kids feel about this? As you know, out in the public, kids get a lot of pressure, peer pressure all the time. How do your kids feel about that? Are they following mom, or do they disagree?
My kids 100% follow mom. You know, I will leave it up to them when they get old enough, obviously, to make their choice. But right now, my daughter sees that she is healthy and that she is not able to attend school with other kids because she was seen as a disease. That's what she took from it. Obviously, I didn't tell her that, but she thought that she was considered a disease.
So she has established some pressure from her peers.
She's established that she says that the lawmakers made her stop going to school, and she believes that mom and dad know what's best for her, not someone that has never met her.
So your kids are not in school right now. You're doing
They're
homeschooling?
not
What are you doing?
Yeah, I'm homeschooling.
All right, you feel that strongly about it, huh?
Yes, absolutely.
All right, Dr. Klosowski, I want to jump over to you if we can. How about your take on all these things there? She has some concerns as a mom for the safety of her kids, but you deal with a lot of kids, I assume, in your practice. So
I do.
How do you feel about it in the big picture?
I think we're kind of in a special circumstance in the United States, being a very individualistic society. And you see a lot of pushback even just from people not wanting to be forced to take the vaccine, not wanting to wear masks out in public. And I take the stance of, you have to do what's good for, herd immunity, so to speak, for the good of the public. And I think there have been a lot of other diseases in the past that have come out that didn't get to this extent. And so people are thinking that it's, government's attempt to control people, to take away our freedoms. And if that was the case, they could have used the opportunity with other diseases. This one has spread far enough, has been severe enough that it's warranted these sorts of measures. And, so I do think as many people as possible should get the vaccine. And I think we have to wear our mask and do what we need to do to get this out of the picture, hopefully as soon as possible.
Now, during my lifetime, I was traveling back and forth to Asia quite a bit, so I saw mask use very, very common for many, many years. I went over to China 2010 to 2013. But in the bigger picture of all the other diseases we've seen, whether they be Ebola, the bird flu, or whatnot, is this more of a danger than others that you've experienced, from your experience, what you've learned about the different?
So as a whole, it's a less dangerous disease than like Ebola. That's very severe. It's very bad. What's bad about this one is how easily it's transmitted. So that's why it's been able to spread as far as it has. Ebola, other ones, they didn't spread as far as quickly. So this one, the transmission rate is very high. And that's kind of how, you see how quickly we heard about it being in China, and then very quickly, all of a sudden, it's in the US, it's in Italy, it's here. It didn't really take very long.
Yeah, that's not surprising, the nature of our society, people traveling all over the place, of course, so that's not a surprise.
Exactly.
But for other people like Gina who have concerns, I guess, what can the medical corporation do to allay some of those fears? You feel very strongly that this is the answer, but she doesn't. So what can we do to allay the fears of the people who are just afraid to take the vaccine?
That's honestly very difficult. That's a very difficult question. Some people who feel very strongly, again, if it's a religious belief, that's going to be hard to overcome, because sometimes no matter, what you tell someone, they stick very much to their religious beliefs and what they're supposed to do for their religion. So I feel like you're never going to win everyone over, to be honest. I do think extended trials and kind of seeing the long term, I think when anything new comes out, people are apprehensive about it. Some people, I think, once they see over time that it's working, it's doing what it needs to, that'll be a big part of it. I think the reason, though, just to note that it was able to come out so fast, scientists started developing a vaccine when we had SARS-CoV-1 and when there was MERS, which are both variants of the coronavirus. Coronavirus is a big umbrella. A lot of people thought coronavirus was a new thing, but it's actually a big umbrella that encompasses several different viruses under it. So
I'm going to stop you there so we can have some closing thoughts from Gina. So when all is said and done, what's the message you want to leave our viewers with tonight?
I think it's to do your research. The problem that arises is that it's around 97% of the people that have it never knew that they had it, being the asymptomatic. So the seriousness of this is questionable. It has targeted people that are older and definitely have complications. There have been trials in other states with things other than vaccines. In fact, Merck, one of the heaviest pharmaceutical companies, stopped its trials of the vaccine because it wasn't working and decided to go the drug therapy route. So I think people just need to do their research and really think about if the risk outweighs the benefit. I would hate to take that risk of injecting something new into my body that hasn't fully been studied and have the consequence be something serious or even death.
All right, on that note, I'm going to stop you there. So thank you, Gina, for joining us. Thank you, Doctor, for coming by to us tonight. And we'd like to thank you tonight for joining us for the Buffalo Broadcasters. You know, we want to remind you that this is a collaboration between Buffalo State and the Buffalo Broadcasters. We're going to be here every night at 6:30, Saturday night, 6:30 here on WNYO. You can see more information on this topic by going to broadcastingbuffalo.com. And please check in for any more information about this unique collaboration. Thanks again for joining us. Good night, everybody.